Welcome to the deep dive. Today we're tackling a health issue that might be on your radar as a pet owner, particularly if you have a dog. Hiatal hernia.
Yeah, it's less common in cats, definitely, but still something owners should know about.
Absolutely. We've got a really detailed source, a good overview of the condition, and our goal today is, well, to pull out the essential information.
Right, making clear what it is, how it happens, the signs, diagnosis, and treatment.
Exactly. We want to give you that clear picture, without getting totally lost in the weeds of medical jargon.
Sounds like a plan.
Okay, so let's get into it. Hiatal hernia. What exactly are we talking about here?
So essentially, it's a structural thing. Think of it like organs from the abdomen, usually the stomach. They move up into the chest.
Okay, into the chest cavity.
Precisely. And they do this through an opening that's already there in the diaphragm, that big muscle separating the chest and abdomen.
Right, the diaphragm.
Yeah. And the opening is called the esophageal hiatus. Normally, just the esophagus passes through it.
But with a hernia, other things are slipping through.
Exactly. The stomach is the most common culprit, just sliding up where it shouldn't be.
Gotcha. And our source mentioned there isn't just one way this happens. It listed, I think, 4 types.
That's right. 4 types. Type I is the most common one. It's often called a sliding hiatal hernia.
Sliding. So it's actually sliding.
Well, with type I, it's the junction between the esophagus and the stomach, and sometimes a part of the stomach itself. It slides up through that hiatus into the chest.
And it can slide back down. Is that why it's sliding?
Often, yes. It can be intermittent, coming and going. Then you have type 2, which is a bit different. It's called paraesophageal.
Paraesophageal. Okay.
Here, the actual connection point, the junction, stays where it should be, below the diaphragm. But another part of the stomach manages to kind of bulge up alongside the esophagus into the chest.
Ah, okay. So the junction stays put, but part of the stomach sneaks up next to it.
You got it.
And then there were 2 more types mentioned.
Yes. Type 3 is basically a mix of the first 2. So you get both the junction sliding up and another part of the stomach herniating alongside.
Combination deal.
Kinda, yeah. And type 4 is when things get a bit more complex. It involves other abdominal organs, maybe parts of the intestine or spleen, not just the stomach, herniating through that opening.
Wow. Okay. And these can happen at birth or later on.
Exactly. They can be congenital, meaning the animal is born with a defect, or they can be acquired, developing later in life.
And that acquired type, the source really linked it to breathing problems, didn't it?
Yeah.
Especially in certain breeds.
It did. There's a strong association with severe upper respiratory disease. Think about those breeds with the pushed-in faces, the brachycephalics.
Like English bulldogs, pugs, sharp eyes.
Precisely. And also animals with a condition called laryngeal paralysis. The effort they put into breathing seems to be a factor.
How does that work? Like the effort of breathing pulls the stomach up.
It's thought that the increased negative pressure inside the chest cavity from struggling to inhale against an obstruction can essentially, suck the abdominal contents upwards through the hiatus over time.
That's quite a connection. Really important for owners of those breeds to know.
Definitely.
So who is most likely to get this? We said dogs more than cats.
Yes, that's the general consensus. It's certainly diagnosed more often in dogs.
And those specific breeds, English bulldogs and sharp eyes, are mentioned as having a higher risk.
They are, yeah. Which, again, points back to that brachycephalic airway structure possibly playing a role, even potentially in the congenital form sometimes.
And you also mentioned type I, the sliding kind, is often congenital. So that means younger animals.
That's often the case, yes. So you'll frequently see signs starting to show up in puppies, sometimes kittens, when they're quite young.
Right. The source mentioned a specific age range, didn't it? Like between 2 and 6 months.
Yeah, often in that window. Sometimes it coincides with weaning, when they're transitioning to solid food.
Okay, so if you have a young puppy, maybe bulldog puppy, what are the signs you should really be watching for?
Well, a lot of the signs stem from the consequences of the hernia. Mainly gastroesophageal reflux, that's stomach acid backing up into the esophagus.
GERD, like in people.
Similar concept, yes.
Oh.
And that reflux causes inflammation called esophagitis. So the most common sign is probably regurgitation.
And that's different from vomiting, right? How can owners tell?
It is different, and it's a key distinction. Regurgitation is usually quite passive. The food or liquid just sort of seems to spill out, often undigested, maybe shortly after eating. There's not much effort involved.
Whereas vomiting is more active, with the heaving and abdominal effort.
Exactly. Vomiting involves active contractions. Other signs linked to that reflux and esophagitis can include difficulty swallowing, that's dysphagia.
Okay.
You might see hypersalivation, so excessive drooling or maybe lip smacking.
Those sound pretty uncomfortable for the poor pet.
They definitely can be. You might also notice a failure to thrive, like a puppy just not gaining weight properly, even if they seem hungry.
What else?
Actual vomiting can occur too, and in more severe cases, or if complications arise, you might see respiratory distress.
Respiratory distress. From the hernia itself or something else?
It could be from the hernia physically pressing on things in the chest, or more commonly from aspiration pneumonia.
When they accidentally inhale food or stomach contents.
Yes, that's a serious risk. And then, of course, you might see anorexia, loss of appetite, and weight loss, especially if it's been going on for a while.
Okay, those are definitely red flags. So going back to the causes, we've got congenital, born with it, and acquired.
Right. Acquired can sometimes happen after a traumatic event, like a major accident.
Makes sense.
But that link to the severe upper respiratory disease, like brachycephalic airway syndrome or laryngeal paralysis, is really significant for the acquired cases.
It seems counterintuitive almost that breathing problems could lead to a stomach issue.
It does, but it's about the mechanics. That chronic increased effort to breathe creates that negative pressure we talked about, potentially weakening the diaphragm around the hiatus or just physically pulling abdominal organs north.
So managing the breathing issue is key then, if it's an acquired case.
Absolutely. It often has to be addressed as part of the overall picture.
Okay, so let's say a vet suspects a hiatal hernia based on these signs. How do they confirm it? You mentioned a physical exam might not show much.
That's often true. Unless the animal is very thin or has signs of aspiration pneumonia like abnormal lung sounds, the physical exam can be pretty unremarkable, especially if the hernia isn't actually out at that moment.
And standard blood tests.
Blood work and urinalysis are usually done to check overall health and rule out other issues, but there aren't specific markers for hiatal hernia itself. You might see signs of inflammation if pneumonia is present, but that's secondary.
So imaging becomes pretty important then, chest x-rays.
Yes, thoracic radiographs or chest x-rays are usually the first step. Sometimes you get lucky. You might see part of the stomach clearly displaced forward into the chest, or maybe a suspicious soft tissue shadow near the diaphragm.
But sometimes it looks normal.
Frequently, yes. Because if the hernia is intermittent, a sliding one, it might look completely normal on a standard x-ray taken at one point in time. It's a bit frustrating.
Like trying to catch it in the act.
Exactly. So while x-rays are essential, they don't always give the definitive answer on their own.
So what's the next diagnostic step if x-rays aren't conclusive? The source mentioned something called a positive contrast esophagram.
Right. This is often more helpful. The animal swallows a contrast agent, usually a liquid barium mixture that shows up white on x-rays.
So you can see it moving down the esophagus.
Yes. And you take a series of x-rays, or ideally use video fluoroscopy, which is like a real-time x-ray movie.
Video fluoroscopy sounds pretty advanced.
It is, and it's really the best for this. It lets you watch the swallowing process and see if the contrast, and therefore the stomach junction or part of the stomach, moves up into the chest during swallowing or changes in position.
And this can help tell the different types apart too, like type I versus type 2?
It can, yes. It can also show if there's a reflex happening or if the esophagus isn't contracting properly to move food along. That's esophageal dysmotility.
But even this isn't foolproof. The source mentioned false negatives are possible.
Still possible, unfortunately. Again, if the hernia just doesn't happen to occur during the, maybe 10, 15 minutes of the study, you might miss it.
Man, diagnosing this sounds tricky sometimes. What about endoscopy? Looking inside with a camera.
Upper GI endoscopy is another valuable tool. A flexible scope with a camera goes down the esophagus.
Right.
This lets the vet directly visualize the lining of the esophagus, look for inflammation, esophagitis, or even narrowing, which we call strictures, that can result from chronic acid damage.
Can they see the hernia itself with the scope?
Sometimes, yes. If the hernia is present when the scope is being passed through the lower esophagus into the stomach, the veterinarian might actually see the stomach lining pulling up through the hiatus.
But again, if it's not herniated at that exact moment.
You might not see definitive evidence of the hernia itself, though you'll likely see the consequences like the esophagitis. So often, it's a combination of clinical signs, breed, age, and these different diagnostic tests that leads to the diagnosis.
Okay, that makes sense. It's like putting pieces of a puzzle together. So once it is diagnosed, what's next? Treatment. The source made a point that not every pet with X-ray evidence needs treatment.
That's a really crucial point. If a hernia is found incidentally, say on x-rays for another reason, and the animal has absolutely no clinical signs, no regurgitation, vomiting, weight loss, then often no treatment is needed, just monitoring.
But if they are having symptoms,
Then treatment is definitely indicated. And for pets with mild to moderate signs, the first line is usually medical or conservative management.
okay. And what does that look like? Is it mostly done at home?
Usually, yes, unless there's a severe complication like aspiration pneumonia requiring hospitalization. Medical management aims to reduce the symptoms and the damage caused by reflux.
So tackling that stomach acid.
Exactly. Reducing gastric acid secretion is key. Proton pump inhibitors, or PPIs, are generally preferred.
Examples being,
Omeprazole, pantoprazole, those are common ones. They tend to work better than the older H2 receptor antagonists like famotidine or ranitidine, though those might still be used sometimes.
okay, PKIs for acid. What else?
We also often use medications to help improve the movement of the stomach and strengthen that lower esophageal sphincter, the valve at the bottom of the esophagus. These are prokinetic agents.
Right.
Cisapride is often used, sometimes metoclopramide. The goal is to encourage food to move out of the stomach quicker and make it harder for acid to reflux back up.
Makes sense. Anything to protect the esophagus itself.
Yes, sucralfate is often used. It acts like a bandage for the esophageal lining, coating it and helping it heal from the acid damage.
And diet. Does that play a part?
It can. Feeding a low-fat diet is often recommended, as fat can sometimes slow stomach emptying and potentially increase acid, and feeding in an elevated position.
Like putting the bowls up higher.
Yes, using gravity to help keep food and acid down in the stomach. Some owners use special chairs or just hold the pet upright for a bit after eating.
How long do you typically try medical management?
The source suggests a trial of about 30 days is pretty standard. You give these medications and dietary changes a chance to work.
And if that doesn't resolve the signs sufficiently, then surgery's on the table.
Correct. Surgical intervention is usually reserved for patients who don't respond well to medical therapy or have very severe or complicated hernias.
Do they continue the medications before surgery?
Yes, typically they'll continue antacids and prokinetics leading up to the surgery to get the esophagus in the best possible shape.
And what does the surgery actually involve? What are they fixing?
There are a few different procedures that can be done, often in combination. One is called phrenoplasty.
Frenoplasty.
Yeah, it basically means tightening that opening in the diaphragm, the esophageal hiatus, making it smaller so the stomach can't slip through as easily.
Okay, narrowing the hole.
Right. Another is esophagopexy that involves stitching the esophagus to the underside of the diaphragm to help keep it in its proper position.
Anchoring it down.
Pretty much. And then there's a left-sided gastropexy. Pexy means to surgically attach something. So here, part of the stomach wall is tacked or sutured to the inside of the body wall on the left side.
To stop it from moving up into the chest.
Exactly. It helps hold the stomach down in the abdomen. The surgeon decides which combination of these techniques is best for the individual patient.
Okay. So after treatment, whether it's medical or surgical, what's the outlook? Is it usually cured or is ongoing care needed?
It can sometimes require long-term management. Even animals that have surgery might still need some ongoing medical therapy, perhaps lower doses of acid reducers or continued dietary management.
So monitoring is important.
It's very important. Post-surgery, you need to watch closely for any breathing difficulty. Or if the regurgitation comes back or gets worse, that might mean the repair didn't hold or needs adjustment.
Any other post-op things to watch for?
Occasionally, if the hiatus is made quite tight during surgery, animals might have trouble eructating, burping. This could lead to some abdominal distension or discomfort, sometimes referred to as bloat, although it's usually different from the life-threatening GDV type of bloat.
Right. Are there other long-term complications?
The main ones are the possibility that clinical signs continue despite treatment or recurrence of the hernia. But overall,
What's the general prognosis?
generally it's considered good. Many pets respond well to medical management alone. And for those needing surgery, it's usually successful in significantly improving or resolving the clinical signs, especially when medical therapy wasn't enough.
That's really good to hear. A positive outlook overall.
Yeah, for most cases.
Okay, so let's quickly recap our deep dive. Hiatal hernia. Stomach or other bits moving into the chest through the diaphragm's hiatus. Dogs more than cats. Certain breeds predisposed.
Can be congenital or acquired, often linked to breathing issues in the latter. Signs mostly relate to reflux regurgitation, swallowing issues, poor weight gain.
Diagnosis uses signs, x-rays, contrast studies, maybe endoscopy. Treatment starts medical acid reducers, prokinetics, diet, and moves to surgery if needed.
And the prognosis is generally good, though some long-term management might be needed.
Excellent summary. The key takeaway really is recognizing those signs, especially in young animals or those high-risk breeds, and getting veterinary advice.
Absolutely. Don't hesitate if you see those signs we discussed.
And that leads us perfectly into our final thought for you today. We talked a lot about that link between difficult breathing and acquired hiatal hernias.
Right, that pressure dynamic.
It really makes you wonder, doesn't it? What other health problems in our pets, things that seem completely separate on the surface, might actually have these kinds of surprising underlying connections that we're only just starting to understand? Something to think about.
Definitely food for thought.
Thanks for joining us for this deep dive.